In the month of January annually, cervical cancer awareness is observed internationally with the main aim of raising awareness about cancer of the cervix and HPV vaccination. This year, the focus is on ending cervical cancer within a few generations. In August 2020, the World Health Assembly adopted the global strategy for cervical cancer elimination, which includes a vision of a world where cervical cancer is eliminated as a public health problem. Cancer is always named for the part of the body where it starts, even if it spreads to other parts later. If you're unsure of what cervical cancer is, it may interest you to know that it is a disease in which cells in the body grow out of control. This occurs in the cells of the cervix, the lower part of the uterus that connects the vagina. Cervical cancer is mainly caused by various strains of the human papillomavirus, also known as HPV, a sexually transmitted infection. Some HPV types can lead to cervical cancer over time, while others cause genital or skin warts. Other risk factors may include genetics, having HIV, smoking tobacco regularly, or any condition that makes it hard for your body to fight off health conditions. In Guyana, cervical cancer is one of the second leading cause of deaths among women. Each year, approximately 121 women are diagnosed with cancer of the cervix.
Because of these high stats, Guyana is actually ranked as number 25th in the world in terms of cervical cancer incidence and prevalence. And so because of this, back in 2007, Guyana, the Ministry of Health took on a program of cervical cancer prevention program, because Guyana was actually one of the countries with the highest in the Latin American region with cervical cancer rates. And so we have decided to increase awareness and to launch a cervical cancer prevention program. And back in that year, we adopted January as a month of cervical cancer awareness, really to bring awareness about cervical cancer and encourage persons to come forward to get screened and get tested.
With the adaptation of the cervical cancer prevention campaign launched in 2007, Guyana continues to utilize a three-pronged approach in order to combat and monitor cervical cancer cases.
Back in that year, we started launching the VIA screening program, and also it's a three-pronged approach. One is to increase the HPV vaccination rate, because we know cancer is linked to HPV, and to get the vaccination. At the secondary level, we were doing the screening that is involved the VIA screening and treatment, and at the tertiary level, to those who were detected with cancer, to get them early treatment and manage the cases. So that's the three-pronged approach. Over the years, we have started with the HPV program. The uptake with the HPV program has not been so good over the years, because we have had a lot of what we call vaccine hesitancy among the population. And this year in 2023, the ministry will actually be relaunching the HPV vaccine. We are trying to actually incorporate it in part of the routine vaccination program for school-age children, and also to push the uptake of HPV vaccine again. Because we know HPV vaccine works. It does help in the prevention of cervical cancer. That's one level. The second level is to get persons screened. More VIA centers is being set up. We need to have more persons trained and to get the person screened on a regular basis. And at the third level is to increase access to treatment and care for those persons who are being diagnosed with cancer, cervical cancer. So we have the oncology unit at the Georgetown Hospital. We have radiotherapy available for those who have been diagnosed with cervical cancer. But we don't want to reach at that stage. But sadly, what we are seeing is that most of the persons who are detected with cervical cancer again are sometimes in late stage. And you know, this is so sad, because cancer by itself is preventable and is also curable. But once you detect it very early, you can actually cure it, and it can be treated. And so what we are seeing is like the late stage, and when people actually start having symptoms and so on, and then they present. By the time it's kind of, you know, it's kind of late.
While cervical cancer produces no signs or symptoms in the early stages of development, one may experience vaginal bleeding after intercourse, between periods, or after menopause. They may also experience watery, bloody vaginal discharge that may be heavy and has a foul odor, pelvic pain, or pain during intercourse in its more advanced stage. With this, it is highly recommended that women from the age of 21 get a pap test done and also repeat it every 2 to 3 years depending on the first test results. Women are also encouraged to speak to a medical professional about the HPV vaccine if you're 26 years of age or younger.
For persons, what we recommending is that one is people to stick to one partner. We know multiple partners increase the risk of HPV infection. Two is to get HPV testing done. One is something that we are actually introducing, is to start to do HPV testing to know if you're infected or not, because those persons who are infected with HPV know they're at a higher risk, and to get yourself screened on a regular basis. Because now one screening alone, you do one screening and then you're good for the rest of life. You need to do it on a regular basis. There's specific schedules for screening and you need to follow those schedules. If you screen and you keep getting negative results, you can know it's because if you detect it early changes, you can actually do an early intervention. So those smoking, we know we encourage women not to smoke because there's another additional risk factor that is related to cervical cancer. In terms of the screening, we recommended, the recommendation is that at the age of 21 you should start getting screened, because from the age of 21 that's when a lot of people will actually probably get infected with HPV before in the early age, because we know, like on the last survey that we did, the first sexual intercourse among our teenage population is actually by the age of 13, and so screening internationally, you start screening at from the age of 21. If you have a negative test, then you screen you back in 3 years later. Then if after 3 years, if you have a negative, you get 5 years later. So it depends upon it. If you screen first and you're positive, well, you get back a screening and 1 year later on. So this specific schedule depends upon your results. But we're recommending that persons from the age of 21 start getting screened for HPV or doing the VIA testing.
When screening for cervical cancer, 3 methods are used to determine if any precancerous cells have developed. These include the HPV test, which checks the cells for infection with high-risk HPV types that can cause cervical cancer. The pap test collects cervical cells to be checked for changes caused by HPV that may, if left untreated, turn into cervical cancer. This will detect precancerous cells that may lead to cervical cancer. A pap test may also identify conditions that are not cancerous, such as infection or inflammation. The HPV or pap co-test uses HPV test and pap test together to check for both high-risk HPV and cervical cell changes. For those of you who are wondering what to expect at a cervical cancer screening, a pelvic examination is usually done, which takes only a few minutes. During the examination, the patient lies on their back on an examination table, bends their knees and put their feet into supports at the end of the table. The healthcare provider then uses a speculum to gently open the vagina to see the cervix. A soft, narrow brush or tiny spatula is used to collect a small sample of cells from the cervix. In performing an HPV test, the sample is sent to a lab where the cells can be checked to see if they are infected with the types of HPV that causes cancer. When both an HPV test and a pap test are done on the same sample, this is called an HPV pap co-test. In addition, the healthcare provider usually provides insight to patients on the examination process to the patient before screening is conducted. Now, let's hear from Anna, a survivor of cervical cancer.
My name is Anna Morris. I'm 58 years old. I have 3 kids. I have 3 grandchildren. I was diagnosed with cancer of the vagina in 2018. One night, I wake up and I go to urine, and when I take the tissue and mop, I see the blood. Next day, I call one of my foundation, the Beacon Foundation, and I told the nurses what I have seen, and they told me to don't put my finger. Then I called my gynae oncologist, and she told me she will get on to an oncologist. I went to him. They did a biopsy. They sent one to Georgetown Hospital. They sent one to Woodlands. And the morning when I get it back, I sit at Woodlands and I open it. And I see all the red markings. I know all the things because maybe through the years I've been through this. So I know to read, I guess. Yeah, so my doctor, he said, don't cry. He said, you know what is happening? I say, yes. And I start one scream. I start one screaming. And they say, I have to do radiation, internal and external radiation. So they write up for me to start the radiation. And so something I have to do at the Cervical lab, because Josh Youngstown never used to do it, but now they're doing, especially a main test that it costs 15,000. They're doing that, the cancer marker. And so I said, where did I find this money from? I said, God will provide. So I tell my doctor, and she says she's coming and she will let us go to the ministry and put the case forward to social worker, and we put the case forward, and they pay for my treatment at the Cancer Institute. The government pay for that. I only had to find my money. I had to pay for accommodation and, you know, different things, and different organizations like the Periwinkle. I could call my clubs because I wanted people to know about them. The nurses from the Beacon here, the Giving Hope Foundation, Dr. Godin Foundation, and so everyone showing, my family and my church, everybody showing a lot, and they and I go to Suriname. And I did the internal radiation. But before I met to Suriname, I had no cancer. The cancer was gone. But when I met over there, the doctor said, you still have to do it because with money already paid. You have to do it because we don't want a recurrence. You know, something is getting a little emotional. You don't want a recurrence, so I did my internal and external radiation from 2018 to now. I was like 3 months lying on my back in 2018 because I was badly born, but thank God that I'm here, that I have life. But you know, all through the years, in 2008 I was diagnosed with stage 3 breast cancer. Yes, I would tell persons, I work with patients who come to do radiation, and you know, and I tell them, family is very important, and friends, because I see through the years a lot of family cancer break up, a lot of family. A lot of friends think that when you have cancer that they will catch it. Yes, a lot of people think that when you have cancer they want nothing to do with you and this thing, but in my situation, no, it wasn't like that. But I would tell them to please support, please show them the love, especially if I see this person not gonna make it. I know, right? Make them comfortable. Women out there, I'm appealing to you to get early screening, because some persons never even go and do the VIE. Some persons so afraid, but there's nothing to be afraid of. I could tell you, nothing to be afraid of, because early detection saves life.
So during this month and beyond, let us work together to build back healthier communities by improving access to HPV vaccination, screening, treatment for cervical precancer, and management of cervical cancer by 2030, and end cervical cancer within a few generations.